Coming up, we'll be on location at Sollay Cosmetic Medical and Laser Center in Baltimore, Maryland, discussing MiraDry that permanently and immediately reduces underarm sweat and odor and also removes hair permanently, with one of this area's top doctors, Dr. Terrence Baker. Welcome, Dr. Baker, to the Top Doctors Interviews. We're looking forward to this interview with you. We're going to talk about the MiraDry treatment procedure that is a really cutting-edge new procedure that has helped a lot of people eliminate the underarm sweat, can also eliminate hair as well. Can you tell us a little bit about what that is and how it's performed?
Yes, MiraDry is a procedure that was first recognized by physicians about 10 years ago using electromagnetic wave frequencies, heat essentially. We found that we could destroy sweat glands, odor glands, and hair follicles under the arms in a way that was pain-free, was timely, that is hour and a half to do the procedure, and that we could take away a disabling condition that has stopped so many patients from being all that they can be. Thousands of people have lost friends and lovers, have lost wives and husbands, have lost employment opportunities because of excessive sweating, just literally pouring sweat from under the arms for no reason other than they were born that way and they inherited. This is a condition that they inherited. So about probably 2 to 3% of the United States population has inherited this condition. Probably another 5 to 10% has obtained it from what I call environmental purposes. That is, they work in a very overheated environment. They take medications that make them prone to sweat. They also carry extra weight, which makes them prone to sweat. They're also out of shape, physically not as fit as they should be, which also makes them prone to have unnatural excessive sweating. All these patients can be tremendously resolved by the MiraDry procedure, which takes about between 1 and 2 hours to set up. Patient gets interviewed, they have an examination, they fill out a comprehensive medical form, and then the procedure itself is about an hour to an hour and 20 minutes in that neighborhood. So this is something for everybody that is having this medical condition. You don't need to suffer any longer. This condition can completely change your life. It can help you to get the promotions that you deserve and the promotions that you need. It can help you to establish relationships and keep those relationships. And it can all happen today. Literally 1 hour from now, every single person listening to this interview could receive the treatment and stop that disease process.
Well, it leads me back to that famous phrase that most people are familiar with, and that is, never let them see you sweat, right?
No, it is so true. We don't realize it. There's some things about people interacting. We're a very social nation. We like our relationships. We like our friendships. Our business relationships are often very cordial and very social in America. But that brings people close together. That's been one of the things about this SARS-CoV-2 pandemic that has really been distressful to so many Americans, is that we have to keep some distance, like you and I are today, keep some distance, because normally we'd be closer together and right up on each other. Today we're observing some social distancing. Why is that? Well, Americans like to be social. We're a very social nation. And the problem is, when you're social, if you have an excessive sweating problem, then everybody knows it. Your sport coat is soaked with sweat. Your brand new white shirt is soaked with sweat. Your new gown, you can't wear sleeveless gowns because you don't want people to see the sweat rolling down, the armpits of your sleeveless gown. And so, because of that, people remove themselves. They don't put themselves in that environment. People find it hard to get a job and keep the job because a lot of employers think the patient must be sick because they sweat so much. A lot of girlfriends don't want boyfriends that have excessive sweating, and men certainly don't want a woman that's constantly having to go to the bathroom because she's soaked in sweat. And so socially, it's something that really disrupts establishing normal relationships with friends and family and employers. And yet here we are sitting here today, literally everyone listening to this 1 hour from now, an hour and a half at tops, could be treated and stop this disease process, because I do consider it a disease. It is something you inherit, it's something that's treatable, but nevertheless it is a disease process, and it results in tremendous disability of Americans all across the country, both men, women, children, everybody's equally affected.
Yes, and it actually affects so many people in society, and there's so many aspects of our life, as you so correctly pointed out, that the sweating can affect, whether it's our social relationships, our professional work environment. So it's definitely really important to get this addressed and treated. Dr. Baker, who would you say is a good candidate for this procedure?
Virtually anyone that has excessive sweating, like for example, I myself have been treated. Most of my staff has been treated. It turns out that virtually everyone can have an improved health and improved social environment, from the patients that have the congenital disease all the way over to what I call the environmental disease, which is related to the factors we talked about, weight, exercise, being out of shape, medications that you take, those type of factors. So virtually everyone can be improved by this procedure. We first focus on those patients with a genetic disorder who are the profuse sweaters, the ones who literally within minutes can go from dry underarms to sweat pouring down. Literally, you'd think that they were in a shower and water was pouring down the sides of their arms. It can happen so fast and be so violent, the profuse sweating that they have. So we focus first on that 2 to 3% of American citizens with that level of disability. And then next we focus on those patients who have had the problem, but perhaps not at that level of severity.
All right. Dr. Baker, you said it takes approximately an hour for the treatment. Is it something that people can come in just during their lunchtime and get done and be back to work, or is there any downtime associated with it?
There's virtually no downtime for most patients. Most of our patients do it at the beginning of the day and then go to work. Some do an extended 2-hour lunch and they come in, get treated, go back to work. Some patients do take the day off, but it's not required. For example, when I was treated, I went to the emergency room and worked a 12-hour shift afterwards. No effects at all. The most that's going to happen for the average patient is you're going to have some irritation, a sense of irritation for which a single dose of Tylenol will be more than adequate. Most patients don't even have that, but we're talking about a single dose or two of Advil or Aleve or Tylenol is all that is required by the vast majority of patients.
That's great. So it seems like little to no downtime, minimal discomfort, almost a no-brainer. I mean, just come in for an hour, get the treatment, and be back on your way.
No, that's true. We actually have people, we're just 20 minutes from BWI Airport here in Baltimore, Maryland, and 20-minute Uber ride over or yellow cab, either one. They can get treated, be back for their plane, and be back home in time for dinner.
That's very impressive. What types of results are your patients seeing from the MiraDry procedure?
Well, for the vast majority of patients, it's instant result. That is, immediately when the patient has done the procedure, they automatically recognize that the sweating has stopped. And a little later on, they'll notice that any odor problems they have, and then later they'll notice no hair returns, little or no hair returns. The vast majority of patients can be successfully treated with a single treatment. We do recommend that particularly for the genetic predisposed patients, that 2 treatments is recommended. But I've only had one, and I've had no return of my signs or symptoms of excessive sweating since I was treated. So it really depends on the patient. At most, it's 2 treatments, and for many patients, 1 will be adequate.
Dr. Baker, that's very impressive. Now, you did mention that it does eliminate hair. Is that for every patient? Is it a form of hair removal as well?
Yes, it is. It's very effective at removing hair. And what we find is, in reality, is that several months after the treatment, the patient may have an occasional hair that springs up. And what we recommend is either the patient will get the second treatment, which a percentage of our patients will get that second treatment, or we'll do a laser hair, literally a 1 or 2 minute little micro laser hair removal for those few hairs that remain. Some hair follicles are resistant. One of the nice advantages is we actually have some patients come in, like redheads, for example, that historically it's hard to use laser hair removal on a redhead or very white hair or very blonde hair. And so this procedure has that advantage of not only reducing and eliminating sweat glands, but also odor glands and hair follicles of all hair colors.
So you're really getting an additional added benefit of having the hair removal as well as stopping the sweating.
Yes, you are.
All right, that's wonderful. Now, Dr. Baker, is this a procedure that the results are permanent for the rest of our life, or is it something that we'd have to get done again in like 6 years or so?
Yes, the answer is that this is a permanent procedure for permanent removal of sweat glands, odor glands, and hair follicles. We know the body is very resilient, and sometimes it has the ability to grow back or rehabilitate some of the glands that we have destroyed or nearly destroyed. And that's why some patients will require second treatment, and some patients may require second treatment down the road, a year or two from now. So it's individual, it's based upon the individual needs, and each patient is unique. But in general, it is always permanent, and the question is, will you need a second treatment in order to get the results that you desire? We're not familiar, although we've heard in the literature that there are an occasional patient that requires a third treatment, but we have not seen that. We've not seen patients requiring a third treatment, but yes, a percentage of patients will benefit from a second treatment, either in a month or two, or they just wait and see how they do, and then schedule that second procedure 6 months, a year, 2 years from now.
Well, it sounds, again, like I mentioned, a great procedure. Is it something that's safe, and is it FDA cleared?
Yes, it's FDA approved now for many years. The use of heat to destroy permanently sweat glands, hair follicles, and odor glands is FDA approved. The equipment is very safe, very effective, and the procedure is pain-free. The only pain that some patients experience is when we apply some numbing medication. The patient may feel that initial needle stick. We use very small, tiny needles. Some patients will perceive that. I did not, but some patients may perceive it. That initial stick, which might feel like drawing some blood out of a vein for a laboratory test, and then after that, the numbing medication takes over, and no additional pain is noted.
So there's minimal discomfort. It's very convenient. You can come in an hour and get the treatment done. MiraDry seems like a very safe and effective treatment. No more sweating. Can eliminate hair as well. And that's an added benefit. So again, it seems like a no-brainer. And I want to thank you, Dr. Baker, for being a guest and sharing this great information with us today.
Thank you very much.